Sir, welcome to the Physicorum YouTube channel. I am expert physiotherapist Sami Burakoktim. In this video, I will talk about the levels of hernia in our spine, the symptoms, diagnosis, and treatments of hernia levels. In my previous video, I explained in detail how the hernia formed in our spine, the risk factors of hernia, and the structures of the spine. If you haven't watched my previous video, you can watch it by clicking the card section in the upper right corner. If we need to move on to the subject of this video, as everyone knows, there are 4 levels according to the amount of hernia protruding into the spinal canal. The order of these 4 hernia levels, from smallest to largest, is bulging, protrusion, extrusion, and sequestration. What is our first hernia level? Bulging. As I mentioned in my previous content, there are 2 basic components in the structure of the disc. The first is the nucleus, which we call the nucleus, pulposus, and the second one is the annulus, which we call the shell. Is fibrosus. As a result of traumas in our healthy disc, cracks occur over time. The pressure of the core pushes the shell outward and the disc begins to bulge. At first, this camber is very small and in an indistinct stage. This condition is called bulging. Symptoms: it may not give any symptoms as it is the beginning level, or it may cause neck or low back pain only depending on the location of the disc. Diagnosis: can only be diagnosed with magnetic resonance imaging. Treatment: it is a treatable level. Since the pathological condition is at the initial level, physical therapy should be started as soon as possible, and it is necessary to start doing patient-specific therapeutic exercises in the presence of a physiotherapist. Apart from physical therapy, it is necessary to reduce the load on the disc and to avoid movements that force the disc. It is necessary to lose excess weight, not to wear high heels, not to bend over to work, not to carry heavy loads, to avoid strenuous sports, not to smoke, not to sit for long periods of time, and to look at the mobile phone and computer at eye level. Our first level of bulging, we can move on to our second level of protrusion. What is our second hernia level? Protrusion. Due to traumas in the shell continues to increase and the shell begins to weaken as the number of hernia tears increases. Due to the increased pressure inside the disc with strain, the core shell pushes outward, causing it to become prominently cambered. This condition is called protrusion. Symptoms: depending on the level of the bulging disc in the spine, it may cause severe pain or numbness and weakness in the arm or leg with pain. Diagnosis: the level can be estimated by the application of hernia level tests. Although it can be diagnosed in computed tomography, the best and detailed diagnosis can be made with magnetic resonance imaging. Treatment: it is a treatable level. Drug therapy and physical therapy should be started immediately. In physical therapy, patient-specific therapeutic exercises should be started immediately, accompanied by a physiotherapist after the patient is relieved. Although corsets can be used initially, use should be reduced or even discontinued with the initiation of physical therapy. For the treatment of first-level hernia, you should not sit for a long time. Except for what I have mentioned, if we are working sitting up, attention should be paid to sitting upright and supporting the lumbar region. Electronic devices such as computers and mobile phones should be used at eye level. Things such as bending forward and lifting weights should be avoided. Brisk walks and your physiotherapist. Attention should be paid to home exercises given by. What is a third-level extrusion hernia? The tears in the shell caused by traumas increase so much that eventually that part of the shell is completely torn and the inner core comes out towards the spinal canal. The posterior longitudinal ligament, which is located in the spinal canal and passes behind our discs, has begun to tear. This situation is called extrusion. This level is also known as the bursting of the hernia. Symptoms: severe neck or low back pain from previous complaints. Alleviates, but as a result of compression of the protruding core spinal cord and nerves, the pain radiating to the arm and back leg intensifies and the feeling of numbness increases. This condition is often accompanied by weakness. Diagnosis: the level can be estimated by the application of hernia level tests. Although it can be diagnosed in computed tomography, the best and detailed diagnosis can be made with magnetic resonance imaging. Treatment: depending on the patient's condition, surgery can be performed. But preoperative physical therapy will accelerate the patient's recovery after surgery. Physical therapy, especially before and after surgery, will reduce the risk of hernia reoccurring and accelerate the recovery of the patient. If the patient's condition is serious and the operation is delayed, the risk of developing permanent numbness and paralysis due to nerve damage in the arm or leg is high. What is a fourth-level sequestration hernia? Unlike extrusion, which is a level 3 hernia, the protruding core breaks off and stands as an independent piece in the spinal canal. At this level, the posterior longitudinal ligament, which is located in the spinal canal and passes behind our discs, is torn. This phenomenon is called sequestration. The symptoms, diagnosis, and treatment of level 4 hernia are the same as level 3 extrusion. As the patient's condition is more serious, the severity of pain and complaints may increase. The healing process may take longer than at other levels. Physical therapy should be applied before and after surgery to reduce the recovery time and increase the recovery rate. Preoperative physical therapy is to shorten the recovery time, and post-operative physical therapy is to prevent the hernia from recurring at the same or other levels. If the surgery is delayed, the risk of developing permanent numbness and paralysis due to nerve damage in the arm or leg is high. It should not be forgotten that not every waist, neck, and back pain is caused by a hernia. Correct diagnosis is important. Do not forget to consult your specialist physician or physiotherapist for the correct determination of the cause of your complaints. We have come to the end of this video. Thank you for watching me. If you specify the topics you want me to explain in the comments section, I will talk about them in my other videos. Don't forget to subscribe to my channel and turn on notifications to be notified of my other videos. Have a nice day. See you in other content.